Assalamualaikum and hi. My name is Najah Harain binti Ahmad Nasri. So today we will discuss about ovarian cysts. So I want to ask some things at to Shaza. Uh, do you ever heard about ovarian cysts? No. So this is like a new knowledge to you. So I can give you something new about ovarian cysts. So today we will discuss about ovarian cysts. This is the topic that I will discuss, which is first about the introduction and then etiology, signs, symptom, emergent modalities, complication, radiographic appearance, technical consideration, and lastly, the conclusion. So for the introduction, actually, this ovaries is actually is a fluid-filled sac that may develop on your ovary, one opus, as a result of ovulation. And you can see 20% of women actually will develop at least one pelvic mass in their lifetime, making ovaries or other names of ovaries is adenomyosis become common. So more than 30 types of ovarian masses have been classified into subcategories, and management is based on the lesion characteristic, the patient age, the risk factor for malignancy. In women of reproductive age, actually most ovarian cysts are functional and benign, and they do not require surgical intervention. And benign ovarian cysts are common in pre-pubertal and with approximately like 68% occurring between the ages of 2 and 12 years. And actually 2 until 12 years. They usually disappear within 6 months. And then like in other 20% of women, actually these ovarian cysts did not go away on their own. So they do require surgery to remove that ovarian cyst, or it will harm their health, which is it will give um, other complication because ovarian cysts actually can cause complications such as pelvic pain, cyst, rupture, blood loss, and ovarian torsion. So next, we go to etiology of this ovarian cyst. So adenomyosis or ovarian cyst can have actually a variety of causes from physiologically normal to ovarian cancer. Although they can develop at any age, actually ovarian cysts are more prevalent in women who are menarche. Menarche means the woman who has their very first period and during their reproductive year because of their endogenous hormone production. So in all ages group, actually simple cysts are the most common type of this ovarian lesion. So compared to simple cysts, mixed cysts, thick and solid and completely solid, actually ovarian lesion is more likely to be malignant. The majority of ovarian cysts actually are benign, but age is the most significant independent risk factor. Means that sometimes if you are at the reproductive age, the risk to get for the ovarian cyst to be malignant is low. And then for postmenopausal women who have any kind of ovarian cyst should receive appropriate treatment and follow up because they are more likely to develop this malignancy. That's why sometimes these ovarian cysts can cause to malignancy. So we go to other causes that might contribute to this ovarian cyst. First is when your gonadotropin or other ovulation-inducing drug are used to treat your ovarian hyperstimulation syndrome. Actually, this might cause your ovarian cyst to develop more and more. And secondly is during the second trimester of your pregnancy, your HCG level is at the highest, right? So when it at the highest, actually sometimes it can develop your ovarian cyst. Thirdly is hypothyroidism. Next is material gonadotropin. Transplacental effect could cause fatal ovarian cyst to form. And the next is cigarette smoking. Lastly, tubal ligation. Tubal ligation actually have been linked to this functional cyst. So next we go to the sign and symptoms. So for the sign is actually the meaning of the sign is the things or the physical appearance that you can see. Meaning something that doctor can see at the patient. The symptoms mean what the patient feel internally. So for the sign, you can see their hair become thin. So means that they have the hair loss. And then uh, you can see also their abdomen become enlarged. Why? Because sometimes this cyst, it actually depend on the ovarian cyst size. So most women have cysts actually less than 10 cm in length. So how it can be enlarged? When your cysts are develop more and more, so the size is also develop more and more. So that's why your abdomen will see larger and larger. And other than that is your weight will increasing because of why? Like I said before, when the ovarian cyst is larger, develop more and more, your abdomen become enlarged, and it also contribute to your weight. So next is you can see the dark spot in the skin, especially you can see in the necks and the armpit. So for the symptoms, first symptoms is the patient will have difficulty in passing urine. Why? Because when you have cyst, ovarian cyst, this cyst will block your urinary tract. So that is why the patient will have difficulty in passing urine because the cyst will eventually block the urinary tract. And then sometimes your back or your leg may feel pain and uncomfortable because of why? Because when the cyst is bigger, sometimes it can constrict the nerve that runs through the back of your pelvis. Means that they disturb the nerve at the back of the pelvis. That's why you may feel uncomfortable and you may feel pain at the back or leg. And then next, you will feel pain in the pelvic or your lower abdomen because when you have a cyst is it gives you a feeling of pressure that occupies part of your abdomen. So sometimes it will lead to fever and vomiting, and sometimes you will have irregular menstruation. So next, we go to imaging modalities. We have three, but the first one I will explain about the ultrasound. So until here, do you have any question? Okay, so I will continue for the imaging modality. So first is the ultrasound. So ultrasound, usually we use transvaginal ultrasound because of it this transvaginal ultrasound is the most widely and used and preferred initial imaging technique for ovarian cysts because it generates detailed image of the ovaries and it allows for precise assessment of cyst size, shape, and also a internal characteristic of the ovary. So, what is the advantage of use this transvaginal ultrasound? First is we will get the high resolution imaging. So, it has the ability to produce high resolution and also the detailed image of the pelvic organ. So this capability actually allow the radiographer or the doctor to detect subtle abnormality that might elude other imaging modality. So when identifying small ovarian cysts, the clarity of transvaginal sonography or transvaginal ultrasound make a significant difference in diagnostic accuracy. Next one is non-invasive. Non-invasive um, is unlike invasive procedure like laparoscopy or salpingography, which is we call it HSG. This transvaginal ultrasound actually is non-invasive. So patient do not require to take anesthesia or surgical intervention, which this can reduce risk and discomfort of the patient. So patient will feel comfortable and they will not feel danger at all. And its non-invasive nature actually makes it appealing as an initial diagnostic option. So next one, we go to real-time imaging. Real-time imaging it real-time imaging it offer dynamic assessment, which is allow the clinician or the doctor to monitor process uh, in real time, which is process like follicular development, ovulation, and also your blood flow through. blood flow throughout the reproductive organ in real time. And also this real time actually understanding aids in precisely timing fertility treatment and it adjusting measure as necessary. And the fourth one is the safety. So this transvaginal ultrasound is generally safe and well tolerated by most patients. Unlike modalities involving ionizing radiation, this ultrasound it is appropriate for repeated use because it uses safe ultrasound wave. So particularly to track the effectiveness of fertility treatment over time. Because of why ultrasound they use wave, so they do not give the patient unnecessary radiation. So patient did not expose to unnecessary radiation and they are safe. And then this safety profile actually improve clinical utility and reduce patient concern. So patient no need to be concerned about getting more and more radiation dose. No, because the ultrasound is just use a wave. And then we have accessibility. Accessibility um, is like it easy to access this ultrasound everywhere in clinic or any hospital. So this accessibility actually guarantee the patient, no matter where they live, they can easily access to this diagnostic tool. And also it help improve patient outcome and it encourage prompt evaluation. Next one, we go to magnetic resonance imaging, which we call it also as MRI. So MRI, if ultrasound results are unclear or there is possibility of a complex cyst or cancer, MRI actually is usually utilized as secondary imaging modality. It actually provides detailed image and excellent soft tissue contrast, which will aid in assessing solid component, wall thickness, septation, and cystic content. So, what is the advantages of using this MRI? So first, it is non-invasive and radiation-free. Actually, MRI is like ultrasound. It doesn't use ionizing radiation, making it safer for repeated use. So this is safe for patient, especially for younger patient or those who need more than one scan because they do not expose to unnecessary radiation. They didn't get extra radiation, so they are safe because this MRI doesn't use ionizing radiation. So the second one is we can this MRI enhance diagnostic accuracy in complex or indeterminate cases. MRI is particularly useful when ultrasound findings are inconclusive. It can help to resolve ambiguities about cyst characteristics, such as the presence of solid or enhancing component, which it will indicate to malignancy. So it will reduce unnecessary surgery, assess complex lesion, and guide treatment. So the third one is it provides excellent detail. Provide excellent detail means that it provides excellent soft tissue contrast. It allows for the visualization of subtle anatomical detail. So it useful to assess ovarian cyst and differentiate between the benign and also malignant lesion. It identifies specific features such as fat content and hemorrhagic components. So next one, we go to computed tomography, which we call it as CT scan. So actually, CT scan is not the first option for the ovarian cyst, but it can be used for staging if cancer is confirmed or when a malignancy is suspected. Typically, it is safe for assessment during pre-treatment planning for a suspected adrenal cancer. It also assesses how the illness has spread to other parts of the body, like your abdomen or the pelvis. So this CT scan, what is the advantage? Although we do not use for ovarian cysts, it also have it advantages, which is first, it offer detailed cross section and high resolution image, which making it possible to precisely assess the density and the border of the cyst, and is especially helpful in complex cases of ovarian cysts. And then next one is the feature like thickened or irregular walls, solid component, and cyst septation that could be sign of cancer. It can be found with the use of contrast-enhanced CT scan. So this improves the specificity and malignancy assessment in ovarian masses. So what is the most suitable modalities? The most suitable modalities is actually transvaginal ultrasound. Because of why? It can accurately identify cyst kind, type of cyst, number and size in uterine follicle, and it able to produce high resolution detailed image of the pelvic organ. And also it's non-invasive and appropriate for repeated use because it is safe for patient or younger patient also, and easy to access. So next one, I will explain about the complication. So the first one is ovarian cyst actually can cause to ovarian cyst torsion. Ovarian cyst torsion is what? The term of ovarian torsion actually describe the full or partial rotation of the ovary on its ligamentous support, which frequently leads to ischemia. Actually, your ovary and your fallopian tube frequently twist together, but this will happen if your ovarian cyst is more than 5 centimeter. And also, it can cause ovarian cyst rupture. A cyst in the ovary actually may burst, and it will cause mild to severe pelvic pain, usually develop suddenly with this. You will, when your cyst is burst, you will feel the pain, mild to severe pelvic pain. And in certain situation, actually, surgical management is necessary, but most can be handled expensively. And um, this actually, the torsion and rupture actually can cause to death if you are treated like too late. Next one, we have hemorrhagic ovarian cyst, which is hemorrhage may develop from an ovarian cyst. There might be internal bleeding occurring in the cyst, and hemorrhagic cysts are usually associated with ovarian dysfunction. When hemorrhagic cysts happen, your ovarian will be like dysfunction, something like that. And then the infected ovarian cyst, a pelvic infection, also known as abscess, can cause cysts to develop. And a ruptured infected cyst may cause sepsis, a potentially fatal immune reaction to dangerous bacteria. So other complication we have is a weight gain, like I tell about that before this, and then you will have the risk to get ovarian cancer. How? So risk to get ovarian cancer is when you have ovarian cyst, such as you have dermoid or endometriomas, is sometimes in the cyst it contains cancerous cells. So when this happen, necessary to close monitoring. And some cases, in some cases actually, you will need to do the surgery because your cyst actually already have the cancer cells. And then you will get other than that, you will get type 2 diabetes, which is actually this ovarian cyst is connected with the development of obesity and insulin resistance. And then it will finally lead to type 2 diabetes. Other than that, you will get uterine cancer, high cholesterol, and cardiovascular disease. Next, this is radiographic appearance. For the ultrasound, how they will see on the ultrasound. So first, you can see this one, the round and the black one is actually, this one is actually the ovarian cyst. It appear round and black on ultrasound. So this cyst actually typically non-cancerous cyst. At the CT, which is computed tomography, this one and also this one is the ovarian cyst. So in computed tomography, cysts are seen as fluid field or complex lesion in the ovary. As you can see, it's like a complex lesion right here and also right here. So for MRI, so for CT, this one is in transversal section. This one, the round and the black one, this the big one is ovarian cyst. So for the MRI, you can clearly see the cyst because it appears as a round or oval-shaped structure that is distinct from the surrounding health tissue. This one and also this one. So the technical consideration. So first, I will talk about patient positioning. Patient was positioned supine on a regular table with their leg slightly bent and abducted. Means that you know the lithotomy position, the one position that usually for women who delivered the baby. So that's called as lithotomy position, like the image. And for the exposure factor, they usually use 6 megahertz to evaluate the patient and often adjusted with color Doppler. Why? Because color Doppler, it we use color Doppler to assess blood flow around or within the scene, which can help differentiate between benign cysts from those with malignant potential. And also the image protocol. Image was obtained in transverse and longitudinal planes to assess the uterus, fallopian tube, and ovaries, and also to ensure complete visualization of cyst size, shape, and structure. So for the conclusion, key point here that it is really important for you or to diagnose ovarian cyst as soon as possible because it can get worse as time goes by. So ultrasound really play an important role to diagnose this type of ovarian cyst, either is benign or malignant. So accurate diagnosis and management is actually important because we want to prevent the simple cyst becoming malignant and prevent the cyst becoming very big inside, and we want to reduce the risk of complication. So this is also to prevent for morbidity and motility as overseas character, torsion, and also hemorrhage, which can lead to death. And then accurate management such as regular observation, follow-up imaging, timely surgery can reduce the risk and improve the outcome and also enhance our internal well-being. So this is the references I used for my presentation. So that's all for me. Thank you. Do you have any question? So different. So like I said before, ovarian cyst is a fluid cell sac that form on or inside your ovary. And actually, they typically this ovarian cyst typically is benign and often develop as part of the normal menstrual cycle. But the ovarian cancer actually is more serious. It can develop from a different type of cell, and it has the risk to spread to other parts of the body. So the main difference is the ovarian cyst is benign, which is it stay in ovary, but for ovarian cancer it can spread to other part of the body. Do you understand? Okay, I think that's all for me. Thank you.